I will be talking a bit about speech and language intervention or therapy that is required for children with learning difficulties and certain associated conditions. Um, I have kept the slide very simple, but I'm hoping that there will be more interaction and I'll be able to answer some of your queries as the webinar progresses. I'll just take a moment, I'll share my screen. You're able to hear me all right?
Yes, ma'am.
Okay, thank you. Right. So, when we say there are needs for children with learning difficulties and associated conditions, there are several domains in which they may need support. But today we are going to be focusing on the speech and language concerns that they may have and what we can do as parents and educators to help these children. So to understand this, we will first try to look at the difference between what is speech, language, communication, and literacy, and how they are related to one another. And then we'll also see how to recognize the signs of communication difficulties in children with learning difficulties and associated condition. Then we also know that when we look at children, when we interact with them in a classroom or in any other context, what we see as overt behavior may actually be because of certain skill deficits. So if a child is showing a behavioral concern, then probably the child has a communication problem or a social interaction problem. So today we are going to look at it from that lens. We see how to understand communication challenges that may appear as behavioral, social, or even academic difficulties. And we'll see how, when and how speech and language therapy may be helpful for these children. What could be certain practical ways to support communication at home and educational settings? And needless to say, one person cannot do it alone, right? We always need a collaboration, and specifically collaboration between the home and school and the center that the child is taking help is very, very crucial. So this collaboration between these different stakeholders, teachers, therapists or psychologists, whoever is working with the child, need to be on the same page. Right? Otherwise, the services get very disjointed and the child gets very mixed signals from everywhere. So I'll just begin by asking the simple question. You can maybe put your answer on chat or quickly unmute and say what you think when you hear the term speech therapy. What comes to your mind when I say that?
Someone who supports a person to speak with better clarity or articulation.
Okay. So a speech therapist works on clarity of speech and improving the articulation of the child. Okay. Any other?
Someone who works on the oromotor muscles.
Okay. Speech expression. Okay. Yeah. Sorry.
We are going to correct the speech if the pronunciation related to the pronunciation.
Okay.
Catering to speech delays also.
All right. So what do they do with children having speech delays? To assist the child with correct verbalization. Okay, that's nice. Thank you all for the responses. I just want you to think a little bit beyond speech and see if speech, why do we call it a speech language therapy now?
Of expressions through language.
Okay, language expression. So can we think of an example? Okay.
Are we teaching them to communicate?
The receptive language and expressive language.
Teaching them to communicate.
Yes, I think that is Spandana who says.
Yeah.
teaching the child to communicate. That was one of the keywords that I was looking for. Thank you.
It's related to
All right.
the
So-
conversation itself, no, ma'am.
Sorry,
Directly,
it is related to?
Conversation or communication.
Okay, yeah. So see, most of us are able to think from the speech point of view, where we say we're trying to correct the pronunciation, we are bringing in clarity in their speech, we're helping them verbalize. Then somebody said we are trying to help them to communicate, right? So we'll just go a little deeper into this, okay? Just have a look at these sentences and see if you have heard or experienced. Language can't be the issue. He never tells me what happened at school. I have to drag every word out of him. My child talks a lot, so language cannot be a problem.
So it is related to receptive language or expressive language, which the child uses to communicate with people.
Mm-hmm. She knows the answer but can't explain it. He can tell me every detail about dinosaurs but can't explain what happened in his day. He avoids reading because he's lazy. He always says, I don't know, even when I know he knows the answer. He's always interrupting and talking over others. He struggles to make friends because he does not know what to say. She gets upset when people don't understand what she's trying to say. So, what do these sentences point to us? Reasons to the language behavior of children, right? One is, like you all say, the personality of the child, or the temperament of the child. Maybe they're very slow to warm up, they feel shy, or inherently they are very introverted, or the child may have some physical issue, like somebody was saying that tongue is tied and not able to move it, or the child is very socially awkward and is not able to use language in a social setting, right? So we really don't know what causes these issues with one interaction with the child. And that is why it becomes very important to look at them over a period of time, and also the context in which they are growing up, before we even decide that this child has a problem or not.
So can expression be an issue with the growth of emotional intelligence? As in, is it really aligned with age?
It's very linked to that. Because emotional skills and social skills go hand in hand. And language is the vehicle there, which carries that, right? When for social skills to improve, there is a need for communication. And whatever way it may be, not just through speech.
Yeah.
Right. So these sentences were a mixed set, Some of them may actually point to a communication difficulty, but some of them may be just the habit of the child or the way the child is. Sometimes these children are mistaken, to be very lazy or defiant, or they don't have motivation, or they have very poor attention. But it could be just that in one situation the child behaved that way. So it's very, very important to observe children over a period of time in different contexts and see if it is persistent, right? Only then we come to a conclusion that they have a certain difficulty. And we may also be missing out on certain cues. The child might be experiencing something, but as adults, we cannot easily see it, and we are not able to take the perspective of the child. So instead of viewing these as communication challenges, instead of viewing these as behavioral problems, can we look at it as some kind of a challenge in certain skills like communication, which is what we are going to elaborate a bit more. From the beginning, when we are discussing about how children communicate, how children relate to the surroundings, the people and objects around them. We keep saying, speech and language and communication in very interchangeable terms, but they actually are not interchangeable, because speech is basically the production of vocal sound patterns. So it's just a physical manifestation of what we think and formulate as language. We are expressing through one medium, that is speech. Whereas language is a little more at the abstract level, or it's more like an arbitrary connection between a particular concept and the symbol that, the symbol represents the concept. So language is basically a symbol system with rules that govern the use of these symbols. For example, when I write DOG, what comes to your mind? If I write DOG on the board, then how do you perceive that? Abstract, and like we are just discussing, it is an arbitrary symbol, right? We are assigning a symbol for a particular concept. So it can be through speech, it can be through writing, it can be through sign language. So that's the difference between speech and language. And communication is basically the exchange of information, the sending and receiving of messages. There is a sender, there is a receiver, and the message goes across. And it's a two-way interaction. It requires the participation of a sender and the receiver. And just to summarize here, speech is the expression of thoughts and feelings through articulate sounds. Language is a set of arbitrary symbols used by a community to communicate. Now, because you also know the language English, I also know it, and we are able to speak in this shared code, right? And communication is a two-way exchange of information. And it can be, processing of verbal or non-verbal messages. Now, speech can have various components like voice, articulation, and fluency. For a particular age and gender, you should have a specific characteristics of voice, and the pronunciation or articulation of sound should be clear, and you have to transition smoothly from one word to the other, one sentence to the other. So that is the fluency. And language has majorly 5 components. The most basic one is the phonology, where it's it is to do with the sounds of the language and how they are combined and how they make meaning in a language. And morphology is slightly a bigger unit of language, but it's the minimal meaningful unit. For example, when I say bus, when I say buses, there is a difference. And that ES that is added there is a plural marker. So aspects like these are studied in morphology. And syntax is the way we, for example, the word order of languages. We put one after the other, following a particular rule, and that's how we combine words to form sentences. So the rules of the language is syntax. Semantics is to do with the meaning of language. So it can be at the word level, sentence level, paragraph level. And pragmatics is the use of language in a context. So what kind of tone can be used, what kind of words can be used in a formal setting versus an informal setting? How do we speak to elders versus how do we speak to our batchmates? So there are differences, right? So that social use of language comes under pragmatics. And communication components are encoding, decoding, feedback, sender-receiver dynamics. And when we say there is a communication disorder, it could involve speech disorder or language disorder. Together, they come under the umbrella term. It is the impairment in the ability to receive, send, process, and comprehend concepts within verbal, nonverbal, and graphic symbol systems. So whether it is speech, whether it is signs, or whether it is reading, writing, when there is a breakdown there, it is a communication disorder. So speech impairments do not necessarily reflect language disorders, and normal speech does not guarantee normal language processing, which is where in children with learning difficulties, most of us get confused because they do have a fluent speech, And with one interaction, you really never get to know that they have a learning disability, they have difficulty in processing written language, right? Much of our learning depends on language, which is why we are placing emphasis on that today. And children need language to understand instructions, to ask questions, to even build friendships, to learn to read and write, to solve problems, and also to regulate emotions. So communication can look very, very different in different sets of children. So there are various developmental conditions that you see in children, right? I'm sure most of us have come across children who are on the autism spectrum, who have hearing impairment, cerebral palsy, global developmental delay, speech sound disorders, and specific language impairment. Earlier it was called that, now it is called as a developmental language disorder, DLD. Right? I've just listed out the characteristics, communication characteristics of these children. Just leave it on for a few seconds. I can take.
Ma'am, under spectrum, you have mentioned about flat or unusual tone. Can you shed more light on that?
Correct. So a lot of these children, when they try to speak, there is no intonation, right? Because they're taught to speak in a certain way. Maybe they have limited verbal output, but whatever they've been trained to do, sometimes they do it without any ups and downs. So it sounds very flat and monotonous. There's another. Yeah, sorry.
Like any example for that?
I mean, earlier, I don't know if you have listened to some children who have been taught to speak, children on the autism spectrum. There will be like a very monotonous kind of speech output. There is the sing-song way won't be there. Yes, I finished. That kind of robotic kind of sound.
Okay.
Yeah.
Thank you.
Yeah, somebody is asking what is joint attention. Joint attention is basically the adult and the child sharing their attention over an object or a person or whatever. So it's like both of them are on one side and looking at something. For example, a parent and a child doing, working on building blocks together. So they both are looking at those building blocks, right? And a simpler, very, very old traditional example would be mothers carrying the babies, showing the moon and feeding them, right? So both of their attention goes to the moon there. So what we see in autism spectrum is that in very early stages, you see that there is no joint attention. Even as infants, they're not able to give that, involve in joint attention activities.
But just, sorry, just one question. Does it typically mean all of these symptoms exist, or it could be one of many, or how does it usually?
It's just a combination depending on the severity and needs of the child. There may be 2 or 3 features, there may be all. It just depends on child to child.
And the degree of the disorder is also a factor, I suppose, right? Like in
Absolutely, yes.
Okay.
Yes. Okay. Yeah, some of them may need minimal help, minimal support. Some of them may need a lot of support. Condition, of course, there are many more developmental conditions, but we all agree that these children need help and they need it as early as possible. So you identify them early, you give early intervention, and then they are able to cope very well. So when they, these children, they find it challenging to maybe produce speech sounds or sequences of sounds, or they may have difficulty in understanding long verbal instructions. Then they may not know what kind of words to use or sentence to use in certain social situations. Sometimes they cannot follow the rules of the conversation. They can't stay on the topic. They may be very, interruptive. They don't know when to, when somebody else is asked the question, they blurt out the answers. So a lot of these kind of things. Then the role of the speech language therapist comes into play. Not only with respect to different developmental disabilities, but also with learning disabilities or learning difficulties, they play a huge role in terms of identifying children at risk for reading and writing problems, because learning disability as such, like a dyslexia or a dysgraphia, becomes apparent after maybe 8 years or 9 years of age, when they are in grade 3 or grade 4. But there may be early on, there may be some signs, that they're not able to say rhymes, their speech is very unclear. So these kind of things a speech language therapist is able to pick up very early on, and then help with the assessment of reading and writing, providing intervention, documenting outcomes for reading and writing. They can also help in preventing written language problems like reading and writing issues by giving a solid foundation in oral language, because we say that oral language almost is like a foundation for written language acquisition. Right? And they also play a role in collaborating with teachers and others who are working with the child. When we say speech language therapy, it can be approached in two ways. One is speech focused, the other is communication focused. And I'm sure we know the difference. Like if it is a speech focused kind of an intervention, the aim is to get the child to use oral language or speech. When it is communication focused, we are also trying different modalities with the child. We just want the child to have a reciprocal social interaction, and therefore we don't mind if the child uses gestures or if the child uses a certain device to communicate. But the idea is for us to enable the child to express their thoughts and feelings through some channel. So in speech-focused therapy, the goal will be clear speech production, and basically children who have unclear speech or certain speech sound errors, they will benefit from it. And mostly the focus is on verbal language. The different things that are used are articulation cards, drills, oromotor exercises, etc. So then that leads to improved sound clarity. Whereas in a communication-focused therapy, the major goal is to enable functional communication in children, and it helps children who have delays in expression or even understanding language, both receptive and expressive language disorders. The modality could be verbal as well as non-verbal. And different kinds of tools are used. AAC can be low-tech or high-tech devices, picture exchange communication system. There are several ways to work on communication. And the outcome is the improved ability to communicate needs, thoughts, and feelings. Now, I'll just leave this on, whether you agree or disagree with these statements. You can just have a look. Language therapy helps. It helps in language development, in understanding instructions, building vocabulary, sentence construction, many more, even use of language in context. Literacy skills, phonological awareness, reading readiness, comprehension, social communication, and communication for learning, and also emotional communication. Yeah. True or false? Very quick check, and then we'll go to the next segment. All children outgrow speech delays.
No.
False.
No.
False.
Speech therapy is only for children who don't talk.
False.
False.
False. Bilingual homes cause speech delays.
False.
May not be.
Somebody said true. Somebody said true. The approaches to language stimulation. Right. Just to close the previous point on how bilingual homes do not cause speech delays, generally bilinguals and multilinguals always have an advantage over children who are learning just one language, because cognitively they have more representations for a single concept. right? So they tend to do better in a lot of ways compared to monolinguals. So when we work on the language abilities to build the language skills in children, we can use various methods and approaches. One could be the general stimulation, and the other would be the focus stimulation. When we have, for most of the children, the general stimulation works. It enriches the overall language exposure, and all these kind of input that we are giving or a modeling that we are doing for the children happens during their daily routine. So there is no separate time where you pull the child, make them sit and teach them certain concepts, right? And it also happens in very naturalistic environments. The communication also happens very naturally. Whereas in a focused stimulation approach, we have certain target words or phrases that we want to teach the children, and we keep using that in different settings. And the focus is also not to, the expectation is also not that the child has to immediately repeat it. The child is listening, absorbing it, and it really benefits children who have delayed language or poor or limited vocabulary. Now, for the very early years, if you want to identify early and give an early intervention, these are the things that you look out for: 0 to 12 months, 1 to 2 years, 2 to 3 years, 3 to 5 years. Right? You can see what is developing at that age and what should you look for and take help. Because the longer the delays go unaddressed, the more a child's social, emotional, and academic development is affected. So I'll quickly show you a video on, a speech therapy session, how it looks like. Of course, it is a Western kind of a video. We have several centers here, even in India, in Bangalore itself. But we can quickly take a look. But before that, I'll just let you know that an initial evaluation happens, like somebody was asking on chat, whether we can send younger children, whether we can refer them for assessment, because specific learning disabilities take time to diagnose. In India, we still follow the IQ achievement discrepancy criteria. So we say that a grade 4 child performs at a grade 1 level, and then there is a difference between they have average or above average IQ, but still they are not able to do academic tasks very well, and therefore they have a specific learning disability. But one can't wait for them to fail in order to help them. So what we can do is send them for an early assessment of the different domains, most specifically within language and communication, how they are doing. So there are also standardized tools, formal assessments that can be done, along with an observation, interview with the teacher or the parent, and interacting with the child in different contexts, and mostly play-based interaction. So the areas assessed are expressive, receptive language, speech sounds, clarity, social communication, oromotor function. Then goals are set. Goals are set based on the assessment findings, parent-teacher input, and the needs of the child at that point in that context, right? And goals should be specific, measurable, achievable, relevant, time-bound. I am sure most of us know this SMART principles for goal setting. Based on the child's age, the developmental level, interests, cultural linguistic background, the parent goals, classroom needs, and if there are any coexisting conditions. Is it just a language delay, or is it because of autism spectrum disorder, cerebral palsy, ADHD, or hearing loss? For example, a child with autism may need visual schedules and minimal verbal input. A child with developmental language disorder may need slow speech and rich repetition. What a speech therapy session looks like. The environment will have to be calm, engaging, language rich. Materials can be a variety of things, from toys to books to picture cards to any alternative augmentative communication devices that are used. Activities could range from songs to imitation games to storytelling. And parent involvement is very, very important. They may be asked to observe, or they may also be coached how to work with their children at home. And goals should be very clear right from the beginning. And the goal should also keep getting adapted over time. Do cause sleep deprivation, social deprivation, attention problems, addiction. They've also been used, if used moderately, they also have a lot of benefits. And what we should do is watch for some signs when we realize that this child is not communicating age appropriately. We just look for these things, whether they have difficulty in following instructions, then limited vocabulary, reading comprehension problems, emotional outbursts linked to communication demands, etc., etc. I'm saying this again and again that not every learning difficulty is a language difficulty, but language and communication influence almost every aspect of learning. So therefore, what we also see, the first thing that we notice is also that the child is not speaking enough, and that all spills over to the communication and the behavioral aspects of the child. So it's very important for parents, educators, and speech language therapists to come together so that these children get the maximum benefit. And the truth is also that children who have these kind of okay, sorry, something on chat. Children who have learning difficulties are actually working much harder than adults realize to understand, process, express language. It's not laziness. It's not because of laziness that they're not reading. It's actually they're putting double or triple the effort and still they're not able to achieve the outcome. So speech language therapy is not only about helping children speak, it's about helping them participate, learn, connect, belong, and have their voices heard. I just shared the flowchart that I was telling Kritika about. And if we have time, we can discuss a few cases. Language disorder. And the question was, if the child does not know the language, then can they be called as having that language disorder? So we will start with what is called as a late language emergence. We see that the child presents with difficulty producing or understanding language that affects everyday functioning. So then the first thing we check is whether the child is unfamiliar with the local language. If yes, then we check whether the child is competent in another language. If yes, then no issues. If no, and if the child is also not unfamiliar with local language, that means we have to watch out for the improvement rate, whether it is okay or very slow, even if we are providing input. If the progress is okay, good pace, then no issues. Otherwise, it is some kind of a language impairment, language problem. And what we are trying to say here is, if the child is not able to combine two words to form a phrase at 2 years of age, and if the child has less than 50 words vocabulary at 2 years of age, then we need to watch out for. And comprehension problems subsequent echolalia. Echolalia is generally seen in typically developing children at a certain stage, and also in children with autism, and sometimes in children with other language impairments, because they're not able to understand, they're just repeating whatever they hear, because speaking is not a problem for them, language is the problem. Language problems even at 5 years of age affects the development of literacy skills. Now we were here, we understood that there is some language disorder, but what we do is next look for any associated condition. If there is an associated condition, say like hearing impairment, then we say it is delayed language due to hearing impairment. If not, it is a developmental language disorder. So the associated condition may be hearing impairment, autism spectrum, intellectual disability, cerebral palsy, language disorders due to epilepsy, or multiple disabilities. A developmental language disorder means there is no other differentiating condition. Developmental means emerges in the course of development. It does not mean the child might grow out of a problem. Unless you provide intervention, they're not able to pick it up. There are no associated conditions. And along with that, we look for any additional information like co-occurring disorders like ADHD, any other behavioral emotional problems, auditory processing problem, executive functioning problem, and any risk factors like family history or neglect, abuse, parent-child interaction is poor, any problems during birth, before birth, right? Yeah, few effect. When it comes to specific learning disabilities, you see that children who get exposed to learning earlier and they enjoy reading, what happens is they get a lot of practice, and then the automaticity comes, like every time they don't have to decode the word, right? So decoding is achieved and it becomes automatic for them. So once automaticity comes, reading becomes a pleasant activity, because the cognitive resources are not spent on decoding letter by letter or word by word. That happens automatically. So they're able to focus on the meaning aspects. And then vocabulary growth is very good. They also get a good attitude towards speech, towards school they develop. And then there is more motivation to read. So this is like an upward spiral. Whereas in children with dyslexia, for example, they don't enjoy reading because it's a very laborious activity, right? Every letter has some sound and they have to remember that rule. And in English, it's even more difficult with the silent letters, with, a particular letter sounding differently in different contexts, in different words. Then they don't get enough practice because they don't read enough. They don't develop automaticity. Reading itself becomes a very unpleasant activity, and therefore they don't pick up more vocabulary. Then the attitude towards school also is not very great, and it affects their motivation to read. That is the downward spiral. So it's basically the Matthew effect is like the rich get richer and the poor get poorer. So the gap keeps on increasing. Children with SLD are at risk for slower language acquisition and slower growth of world knowledge across their lifetime. That if we follow the traditional reading way of doing things. Now with the advances in technology, I think children with dyslexia are doing really well. At least in the university setting, we see that there is if we provide them with multiple means of, the materials are given in different ways, they're allowed to write or express their learning in different ways, they are flourishing. Resolution. So stories really work with children if you want to work on the narratives, not just, planned stories like in the story grammar. It could be anything, our contextual Indian stories as well. So it gives them that flow of, it starts off with something, then something happens, somebody comes, and towards the end, this is what happens. So that structure, that sequence, and the flow, they need to understand. And that's when you can also introduce things which are there in story grammar, right? One is the setting itself, who are there, where are they, what are they doing, what happens first, and then the internal response. What do you think the giraffe is thinking about? Why do you think the elephant sat down? Things like that. What is actually going on within the character's mind? And what is the plan? What do you think now the giraffe is going to do?